Hello friends, Dr. Abdul Khaliq here, medical gastroenterologist and CEO of Umda Healthcare. I'll be discussing a concept from aviation industry that is called as STERILE cockpit rule. When compared to the aviation industry, wherein efficiency and importance is given to the safety of the passengers, there are many concepts which the healthcare industry needs to learn from aviation industry, because the number of mishaps and deaths that occur in the aviation industry in an annum are decreasing year on year to an average of around 250 per annum, whereas the number of deaths that are occurring because of medical errors or because of mishaps in the during healthcare delivery are estimated to be around 2 lakh deaths, preventable deaths in an year in a country like US. Or in gross, if I want to say that if the amount of mishaps that occur in the field of healthcare occurs in the aviation industry, almost 3 flights will be crashing on a daily basis, which may be untenable with any other industry other than the medical industry. So there are many things that we can learn from aviation industry. I'll be discussing a small concept of STERILE cockpit rule. It is commonly seen that major accidents that occur in aeroplanes are either they occur while taking off or while landing. So that is the time wherein the coordination and concentration of the pilots is important. So there is a rule that these pilots will be speaking what is only necessary till they attain a height of say 10,000 feet. After 11,000 feet they can speak anything, but again once they are coming down, once they reach up to 10,000 feet, again they will go into the mode of STERILE cockpit rule, wherein they will be discussing when it is required and what is required for landing of the flight. If we take this concept and apply into our healthcare, many distractions can be prevented. Like for example, in my specialty of gastroenterology, while doing a procedure called ERCP, there are a few critical steps like selective cannulation of either the bile duct or a pancreatic duct requires some skill and concentration, as well as while cutting the sphincter, some concentration is required. So during these critical phases, at least if we apply such a concept of STERILE cockpit like environment, wherein the technician, the nurse, the anesthetist, as well as the endoscopist are speaking only the things which are necessary without any distractions, then the chances of success are high, the chances of complications will go down. In the same way, this can be applied in many other areas, like while writing the prescriptions or while giving the medications to the patients, or while doing the surgeries, particularly in the operation theater. The whole of the time during the surgery can be made into a STERILE cockpit like place, or at least at the areas or the time wherein more concentration and less distractions are desired. At that point of time, an understanding of the whole team should be there that during this time we should not be talking anything which distracts, and we will be concentrating on our work. Hope that this concept will be useful for your day-to-day clinical practice. Thank you.